Hello, hello. Hello, everybody. Welcome to this session, Turning Planetary Health and Earth System Science into Beneficial Action. That's the session you've joined. Thanks for joining us today. My name is Jane Madgwick, and I'm the Executive Director of the Global Commons Alliance. I'm a humble ecologist here to learn about how to better connect ecology and conservation, sustainable development with planetary health. But my journey here started far away, long ago, in my work with Wetlands International, where I worked alongside health and humanitarian organizations, mostly in developing countries, and began to see that really we should work together. And at COP28, we organized a session to explore this topic, to just open it up. And that's where I first had close contact with Jamila, who was in that session, and also Courtney, who's here, who you'll hear from later. And the Planetary Health Alliance is actually a partner of the Global Commons Alliance. And recently they invited me to be on their board. So we're getting closer and closer. And hence myself and my colleague Aditi are here to really strengthen these relationships, but especially to listen and learn. So I'm looking forward to learn also from all of you. Before I go any further, let's check who's in the room. So who is from the academic world? If you put your hands up. Okay, we have a lot of smart people here. And who is especially from the health sector, academic or non-academic? Fantastic. And who is from the climate, who would categorize themselves more from the climate and environmental sector? Brilliant. Well, we're really well integrated already. And any business people in the room? I know we have at least one. Okay. I probably missed a few categories. NGOs? Yeah. And media, indeed. Yes, we have some media, and one will be on the panel, a journalist too. Fantastic. So we're a very good group, and that's good, because this is not about people talking to you. This is about a conversation, because we have a job to do. This whole conference is about examining the evidence and how we can move to action, confronting reality. And we want to actually come out of this session with a few clear recommendations that can come back into this whole conference. And we have a place to land some of those recommendations on Friday. More of that later. So it will be a couple of presentations and contributions from our panelists, but there will be a lot of Q&A. And for that, I will, of course, invite you to speak in the room. But we also have online guests, participants. And so there is a Slido opportunity. So if you rather write your question, you may do that. So if you just click on your QR, use your QR, and then go to Lecture Theatre 8, you will be in the place where you can write your question, and you can see everybody else's question as well. So as people are talking, maybe you can think what your key questions are. So the format of this is going to be, to begin with, I will make a short introduction. Then we will have two keynote presentations, essentially. One will be given live, but online, and the other one is a recorded one. And both presenters will really give you some meaty context for the discussion. Then we'll have chance for Q&A around those presentations. And then we will turn to some panelists who join me here up front in the room, and we'll hear from them and continue the conversation. And then we'll try to draw some red threads. What are the key points that we agree on here? What do we, maximum 5 points do we want to recommend from this session? So that's the plan. And we will adapt along the way as things go. So let me start with a quick introduction. Oh, you're going to do that for me. Okay, I'm going to sit down. So first of all, the global commons, in case you're wondering. These are all the interconnected natural systems that support all life on Earth. And next slide, please. As we've heard, they are in crisis. We are in a multiple emergency situation. You heard from Johan Rockström yesterday in the plenary. We are probably heading faster than we thought towards irreversible tipping points, multiple ones, faster than even the most pessimistic climate models predict. So it's a very serious situation. We need to move into action. Yes, so this illustration is about those tipping points. And we need to take this as our backdrop, the planetary boundaries science, this understanding, but we need to move into positive action. Next, please. So what we know is that it really is possible for positive tipping points to be pushed by people, by social action, and that this naturally comes from local societies. So behavioral norms don't happen at the global level. We can look at the problem at the global level, but actually the solutions are always going to come from the local level. And the point that we're facing, the challenge we're facing, whether Global Commons Alliance or Planetary Health Alliance, is really to push from bottom up to address the global problems and to have interconnected action at all the different scales. So that's what we're aiming at. And history is on our side. It shows that actions of individuals, of cities, of small groups can really challenge the powerful forces and trigger abrupt global change just within a decade. So it is possible. But to bring people into action, we need actually more than science. And that's what we'll discuss today. It needs to be science-based, but we need compelling storylines, we need scenarios, we need visions to head towards. So the Global Commons Alliance, and especially its Earth Commission, are working very hard on this. And they're presenting human-faced operational perspective that can be put into practice at different scales. And the Global Commons Alliance is busy building its alliance and convening and mobilizing partners to help everybody take action. Now, I was going to say as guardians of the Global Commons, but I learned in the last session that that's a pretty Western concept. And that actually we need to probably learn from the Eastern culture that it's more about, I think the word used was merging with the natural systems to bring change. So very interesting. So this session will explore these topics. And next, please. Yes, so this is what we're all about, moving into action, enabling action. Next, please. And from this session, this is what we aim to achieve: greater understanding, to really frame the challenges and opportunities that can mobilize connected nexus solutions, and to trigger and foresee more partnerships, more knowledge sharing, more learning between the health and environment sectors in particular, because that's a powerful, potentially a very potent force. And we have the opportunity to input to the plenary session on communications that's happening on Friday. They are expecting some recommendations to come from this session to land there. So that's our challenge. And without more ado, I would like to hand over to my co-host, Professor Dr. Kristie, who's an Earth Commissioner, but also a professor at the Center for Health and Global Environment at the University of Washington. And she's going to lay out this picture for us. Thanks, and over to you, Chris.
Well, thank you very much, Jane. I'm sorry I'm not there. It sounds like you're having a really fascinating conference. I look forward to hearing what is going to be coming out. As you heard from Jane, I'm going to provide a brief presentation about Earth system boundaries, and then we're going to hear from Professor Andy Haines. And I am now going to try and share my screen. Okay, so somehow Zoom's been turned off sharing. We have our first challenge of the session is apparently the way Zoom is set up at your end, it's keeping me from sharing my screen. The only way I think I can do it is to quit Zoom and come back in. But let me try and see if it'll do this anyway.
Chris, we're going to solve it here, I think. Am I right?
I might have figured it out. I think I have it.
Yep.
That was a
Good.
short, of course, we didn't start right at the beginning, so sorry about that. So good afternoon, everybody. As you heard, I'm Kristie, and I'll talk a little bit about the Earth system boundaries and how they're affecting human health and well-being. As you heard, the Earth system boundaries are part of a process that Professor Rockstrom is leading through the Earth Commission. The Earth system boundaries go beyond planetary boundaries to look at not just what is safe for the planet, but what is just for the inhabitants. The figure on the right is the key figure from the research that was done in the first phase of the Earth Commission. You can see as you go around the circle a range of Earth system boundaries that were analyzed. These were the ones for which it was possible to do modeling at the time. There'll be expansion of the Earth system boundaries in the second round of the Earth Commission. As you look at this figure, you see in the middle, there is a dotted line that provides the floor, the foundation for looking at safe and just corridors into a more resilient and sustainable future. For each of the Earth system boundaries, you'll see there are a number of depictions of the Earth, where we stand. I understood you heard from Professor Rockstrom earlier in the meeting about this. And then individually, you'll see for some of the boundaries for climate, for aerosols, and for nitrogen, there are blue and red lines, where the blue lines are based on the analyses that were done, what is safe for all of us? And the red is what is just for the planet. For the other Earth system boundaries, you'll see a solid green line. And this is because the safe and the just boundaries coincide. That was not expected. We did not know when we started the work on the Earth Commission that for so many of the boundaries that safe and just would be essentially the same. And you can see, particularly for climate, that we are right now collectively between the just and the safe. The safe, of course, was defined by the Paris Agreement, and the just is keeping warming to below 1.5 degrees. But we're not doing so well with the other Earth system boundaries. And I will talk briefly about each one of these just to give you a sense of the richness of what information is available. The biosphere, you heard just a little bit from Jane, and I'm sure you've had other presentations about the biosphere. The modeling in this area considered not just ecosystems, but looking at biodiversity and looking at genetic diversity to make sure that there is sufficient genetic diversity to support our biosphere. We also looked at nature's contribution to people. There's some headlines here just illustrating some of what is known about the importance for ecosystems for our health. I'm sure you've got quite a few sessions on heat waves. We know the urban heat island exacerbates heat waves and increases in mortality and morbidity as a result. There's an example of flooding from Italy, but there's been so many places around the world that's had significant flooding events in the last year or two. And finally, there's a headline about the pollinators and how loss globally of pollinators could be leading to 500,000 deaths every year. And these are just a few of examples of what we know about the importance of ecosystem services for our health. Fresh water, of course, we need to ensure that there's safe water for everyone, that people do have access to sufficient, and we used to call it clean, but it's really safe because water can look like it's clean, but actually not. Fresh water also considers our fisheries. So many people around the world get most of their protein from fresh water, and ensuring the integrity of that is important in its own right. It's also important to protect our health. The safe boundary for surface water was defined to ensure that we do not alter natural flows in rivers by more than 20%. That safe boundary is already significantly breached. The just boundary has also been significantly breached. And you can see from the map for Asia and the Pacific that natural water flows over land have already been altered in 33% of the areas by more than 20%. Nutrients focused on global nitrogen and phosphorus cycles. The modeling calculated the maximum allowed agricultural surplus for what needs to be used on crops. We know that there is overuse worldwide of nitrogen and phosphorus, particularly in high-income areas. It's underused in places like Africa that does need more nutrients in the soil to ensure adequate crop productivity. But that surplus in so many places drives environmental degradation. We know the excess nutrients from fertilizer go into our soils, our fresh water, and our oceans. These excess nutrients also lead to significant emissions of greenhouse gases and of aerosols. This is one of the few Earth system boundaries where boundaries were set at local to global scales. Nitrogen, obviously critical for much of our crops, but too much leads to the runoff in surface water that results in eutrophication. Also affects our land ecosystems. So the scientific literature was used to model that surplus, noting that the harm to health, the just component, comes from the loss of ecosystem services, from having access to safe water. I'm sure many of you work on issues like toxic algal blooms. And so looking at the wide range of impacts from nitrogen on our ecosystems, on our health. The Earth system boundary was slightly more stringent on the just side than on the safe side. And globally, as you saw in the first figure, nitrogen is far outside the safe and just boundaries. Aerosols. Aerosols primarily focused on monsoons, but we do know that aerosol is critically important for our health. This is one of the results from the analysis showing the overlay of PM 2.5. It's a particulate matter that's known to be particularly harmful to health. And poverty. This is not a surprising result, but it is a very helpful visual that on the health side, there is lots of information about PM 2.5, its distribution, how it flows from one place to another in the atmosphere. But this highlights how we have to focus on the just side as well and make sure that the kinds of actions going forward, the actions that Jane talked about, make sure that we focus on both sides of the challenges we face to make sure that we protect the most vulnerable. The Earth Commission went beyond just defining the safe and just corridors, but started talking about issues such as linking actors to guide practice. And noting that when we think about the actors, they need to share not only their responsibilities for reducing the challenges we face within each of the Earth system boundaries, but also share the total resource budget that's available. and making sure that this is done equitably. Transformations are underway. Those need to be accelerated, and these are some of the key principles when thinking about transformations. As I've emphasized, allowing access for the poor and the marginalized, reducing the pressure on our Earth system boundaries and the harms to humans and our ecosystems. Justice has to be a critical element. As Jane noted, we need to account for social drivers and barriers and focus on ensuring that we facilitate positive change so that we provide a safe and just corridor to the future. Here is the URL for the Earth Commission. I strongly encourage you to go there. There's a richness of information and follow up on anything of particular interest. Of course, I'll be happy to answer questions when we come to that portion of the session. But now I'd like to introduce Professor Sir Andy Haines, who's going to talk with you about some companion work that he's been doing to identify actions that are effective, not theoretically, but actually provide us evidence of ways we can move forward. With that, I look forward to hearing from Andy. Thank you very much.
Thank you very much for inviting me to speak. I'm sorry I can't be with you in person, but what I'd like to do is to give you a brief overview of the Pathfinder Initiative, which so its subtitle, as you can see here, is Pathways to a Healthy Net Zero Future, which gives you a good idea of what it's trying to do. The focus of the Pathfinder Initiative really is on incentivizing rapid cuts in greenhouse gas emissions, emphasizing the value and the importance and the magnitude of the health co-benefits of moving towards a net zero emission economy. So obviously adaptation is needed because climate change is with us, but this needs to be accompanied by rapid mitigation. And rapid mitigation will bring additional health benefits over and above the benefits of reducing the risk of dangerous climate change. And we believe that better evidence can support ambitious collective action on climate and health to reduce the risks to humanity. And so the Pathfinder Initiative aims to bring together evidence from studies across the world and in different sectors that are responsible for large emissions of greenhouse gases. So sectors like energy sector, the transport sector, food, and so on. And it aims to map out the different pathways to health and map out and give an estimate of the magnitude, the size of the co-benefits to health of moving towards net zero emissions in these different sectors. And it brings together the evidence that has been collected into an evidence bank, which, as I'll mention, is open access. So essentially, it involves an umbrella review, which is an overview of systematic reviews of climate change mitigation actions. So it brings together the evidence from these different systematic reviews and enables the quantification of both the climate benefits and the health benefits. And of course, the aspiration is to influence the outcomes, to accelerate progress towards net zero emission targets, to support improved health and flourishing societies. And for those of you who want to know more, you can read our published Lancet report, which was published towards the end of last year, and you can download the report from the website. Well, let me start by saying that the benefits, the health co-benefits of rapid climate action are potentially very large indeed, but they're not being implemented at the necessary speed and scale. And on this slide, you can see a summary of some of the headline figures. So recent estimates published in the BMJ, again, just before Christmas, suggested over 5 million premature deaths annually caused by air pollution from fossil fuel burning. So in addition to driving climate change, there are also these deaths from air pollution from the burning of fossil fuels in the energy and transport and other sectors. We also know nearly 4 million deaths have been estimated annually to be linked to physical inactivity. And one of the ways of addressing that, of course, the most likely to be the most successful way of scaling up opportunities for physical activity is through more sustainable transport systems, using public transport instead of using the private car, walking and cycling preferably in safe and secure environments. And then finally, the food system. We know that agriculture, food and land use, drives perhaps a quarter of emissions, perhaps a little bit more, depending on what you include within that broad sector. And the Eat Lancet Commission showed us that over 10 million deaths annually could be prevented by shifting to healthier diets over coming decades, so perhaps by mid-century. So when you add all these together, you can see there are very major opportunities. You can't just simply add them together because they affect the same health outcomes in many cases, but substantial, very, very large benefits indeed to health from rapid mitigation actions. And of course, it's important to ensure that effective policies address inequalities in emissions, because there are dramatic inequities. We know that the top 10% of emitters are responsible for nearly 50% of global carbon emissions, and the bottom 50% only 12%. So big issue of climate injustice, and the mitigation strategies need to bring together, need to converge emissions as quickly as possible. This just shows you some headline findings from the umbrella review, and you can see on the left side the different actions that were taken through the built environment, through cook stoves, multi-sectoral actions, electricity generation, AFOLU, agricultural, food and land use, transportation. And on the right, you can see through different pathways how they affect a range of health outcomes. All-cause mortality, of course, is commonly used, but also some studies specify cardiovascular disease outcomes, diabetes, trauma, even depression, respiratory diseases, and so on. And this slide just gives you some of the headline findings. I won't go into great detail, but what you can see on the right side are the healthcare benefits. So these are the changes in life years lost, in other words, equivalent to life years gained by a mitigation strategy, for example, moving towards clean, renewable energy and away from the burning of fossil fuels like coal. On the left side, you can see the benefits in terms of greenhouse gas emissions expressed in carbon dioxide equivalents, allowing combination of CO2, which is the biggest long-acting greenhouse gas, and methane, for example, which is a short-lived greenhouse gas, staying up in the atmosphere only 12 years. So you can see on the left the climate mitigation intensity, on the right the health co-benefit intensity, as we're calling it. And you can see, for example, if we look at AFOLU, very big potential benefits to health from these global modeling studies, and quite substantial benefits to greenhouse gas emissions. In terms of electricity generation, we have very big benefits, as you'd expect, to greenhouse gas emissions, smaller benefits in terms of health, but it varies enormously depending on where you are in the world. So it's about an order of magnitude greater in India than some high-income countries. And we believe that many of the healthcare benefits are underestimates because they don't take into account the recent evidence that low levels of air pollution can be damaging to health. So undoubtedly, if we rerun some of those estimates, that they would be larger than they are in the published literature. Clean cook stoves, very big health benefits through reduced air pollution, but smaller climate benefits. And then the multi-sectoral actions, very, very variable, as you'd expect, different combinations of policies. And what you can see is there's big effects of context. It depends where you are, what kind of policies you implement, what is the comparator, what exposure response relationships you use, and so on. So it's important to understand the context and the region in which particular policies are being implemented. But overall, what we need is a combination of policies which both address greenhouse gas emissions, but also capitalize on these potential health benefits. And then I would like to give you just a few examples, concrete examples. Most of the studies that I've described from the previous slide were modeling studies, about 90% of them. We didn't find as many implemented actions as we hoped, because we also had a call for implementation case studies, and we found about 30 of those. Many of them were rather small scale. This is one of the larger scale ones. It's the effect of renewable energy portfolio standards in the United States. And you can see that this averted nearly 150 million tons of CO2 emissions in 1 year alone, because of the increase in solar and wind power generation. And you can see that over the period of the study, many thousands of premature deaths were prevented from reduced air pollution. So it gives you an idea of the magnitude of the impacts, the benefits to the climate, obviously, but also to human health as well, even in a high-income country like the United States. But of course, it depends on what the renewable energy is replacing. If it's coal, there's a much bigger benefit than if it's replacing gas, although gas still does emit, of course, pollutants like NO2. And then healthy housing. This is a nice. This is the only randomized trial we found. This is from the Victorian Healthy Homes program, where they upgraded 1,000 low-income households. Half of those were randomized to have the upgrade before the winter months and half after the winter months. And they found nearly 6,000 tons of CO2 equivalent emissions were avoided in the winter, and 11,000 when you put it over the whole year. And importantly, the upgrades led to warmer homes. There was reduced subjective feelings of breathlessness, better mental health, and reduced healthcare costs. For every Australian dollar they spent on the upgrade, they saved about $9 on healthcare costs. So that was a big benefit to the healthcare system from these upgraded houses. And then we found another study of Maspices menos emisiones in Argentina, in Buenos Aires. And this was a study which was evaluated the promotion of active travel, a bike sharing scheme, and a cycle lane network. And this led to an estimated reduction, because people were less likely to use their private cars and presumably motorbikes as well, of about 12,000 tons of CO2 emissions reduced, and an increase in the number of bicycle trips, but nevertheless fewer cyclists killed in road accidents because of the safer cycling opportunities. It didn't quantify the benefits of increased physical activity, which would also be occur, particularly if you could get sedentary, older, middle-aged people walking and cycling. And then finally, this example of nature-based solutions. In other words, protection, in this case, protection of tropical forests in Indonesia. The NGO Health in Harmony undertook what they called a radical listening exercise, working with local communities to try to understand why they were deforesting. And they found that one of the major drivers was the need to gain income in order to pay for healthcare costs. So what they did was to provide affordable healthcare for these communities, and they were able to show that the communities that were provided the healthcare, there was reduced infant mortality and a range of other health benefits. They were much less likely to rely on forest deforestation income, selling the timber, and that reduced above ground carbon loss by nearly 600,000 tons over the period of the study. So there was a dramatic improvement in access to healthcare, but also a reduction in illegal logging in those areas that were provided with healthcare. So a very good example of how you can benefit nature, benefit the climate, benefit human health. And if you want to know more, this is the Climate and Health Evidence Bank, which gives you access to all the case studies that we found, also the model studies and the estimates that we've made. And so you can download whatever is of relevance and interest to you. We'd also encourage you to send in, if you're aware of case studies where investigators have implemented actions and measured the benefits to climate and to health in some way. We would be very interested to hear more. So in conclusion, let me say, and this is not my work, this is the work of the Commission. My colleagues, Helen Clark as a co-chair of the Commission, and Joy Fumafi as the other co-chair of the Commission. And the key messages from the work of the Commission was that there are potentially very large health benefits, as shown by modeling studies, less evidence around implementation, so it's implemented actions that we need to accelerate. The main pathways to health are through cleaner air, healthy diets, physical activity, and also we believe that nature-based solutions show a lot of promise, whether that be through forest protection, green space in cities, and so on. So it's important then to integrate these healthcare benefits into climate policies and the UNFCCC processes. And when we move towards a net zero economy, it's important to think about system-wide approaches, not just focusing on a single action or intervention, but how we can accelerate action across sectors and avoiding trade-offs and disbenefits, like driving more people into poverty by increasing the cost of energy, for example. This will require improved monitoring, better harmonized research, and we're currently working on developing a coalition of partners, working with city partners like C40 Cities, with the Sustainable Development Solutions Network, with the OECD, with CDP, and with other networks that are committed to ambitious action on climate and health. So in concluding, let me say that there's a lot of work to do. We really need to accelerate action, the speed of action, in order to prevent dangerous climate change. But there are major health and other co-benefits to be had from rapid climate action, and we need to ensure that the health community and the public more widely and decision makers are aware of these near-term benefits, and that these benefits are used to accelerate the speed and scale of action. Thank you very much.
Fantastic. Well, so Andy can't hear us, but we really appreciated his presentation. I think what was striking about the presentation from Chris and from Andy was the quantification. You know, we're not just talking in qualitative terms now about how to connect change for environment, climate with health, but actually we have Earth system boundaries that speak to that. We have the Pathfinder Initiative has outlined how we can package and bundle the different benefits for environment and how they lead to a whole array of benefits for health. And this is quantified. It's nice to see that there are already a growing evidence base of examples of action. So this is where we are in our conversation, from science to action. I did take a quick look on the Slido. I didn't see any questions. So if you have a question for those in the room, I'm going to come to you in a minute. I'll just start that off. But do also, in the room or online, please post them on Slido. I'll take a look in a minute, see what's there. But Chris, just to kick us off, because I know you are also part of the Pathfinder Initiative. So Andy said you can answer any question that we might have. So I have a big question. That is, how sufficient do you think the evidence base is for action on climate, environment and health as an integrated package? I mean, do we actually know the path and it's just a question of walking along it, or are we still really lacking in the evidence base for that to be secure?
Thank you, Jane. I'm going to turn that question slightly and say we have a lot of information. That information is not getting to the policymakers, and it's not getting sufficiently to the funders. So you saw from Andy's presentation, we know there's many ways that mitigation improves human health and well-being. There's enough to start working with. We need more evidence, but more importantly, we need the policymakers to pay attention, and we need the funders to come forward with excitement about all the potential for the ways we could address at the community level the challenges related to climate change, related to the Earth system boundaries, and working with communities to ensure that we do move on the path to a sustainable and resilient future. So it's a mixed message of we have enough to start. We're going to need to gather more evidence as we go along. And importantly, that evidence is going to have to be put into action across multiple actors. And from the scientific perspective, we're just one voice in this discussion.
Thanks, Chris. Now I'd like to turn to those in the room. Hello, I see a lot of good friends here already. Yeah, we have a roving mic, so yes, please. Please also state your name, where you come from, and then your question.
Thanks for inviting me. Now you're in trouble. I'm Felipe Camargo. I have 2 points that are some kind of missing from the discussion, at least in my opinion. One is population control, because we keep about doing all these things to ensure that people don't die. But on the other hand, we don't talk about population control. And I think that's very relevant and important to the discussion that we're having. It's not just about keeping us alive, but also looking again at issues related to population control, which we used to look at in the past, but it seems that we are not talking about that anymore. So I think that's something that I like to bring to the table. The other one is to actually bring action to the local level, and that's where I myself feel information is not there. We've been in the day today and a bit yesterday flooded with information about what is going on and what is happening as far as the damage, the situation, the crisis, the risks. But still, we know very little about what the options are, when it comes to accessing resources at the local level, when it comes to implementing some of what has been put into the treaties that needs to be implemented in countries like Colombia or here in Asia. And we in the field, those local level communities, know very little about this information. So it's a call for action when it comes to producing some kind of inventory of what's there available for us. You know, we are small farmers that want to do things better. How do we go about it? What do we need to do? How do we access those resources? And it's not only at the country level. I know about some of these things because of my previous experience, but I know that people in the village where I live in Colombia know nothing about it. Thanks.
More questions? There's a lady at the back and a gentleman, and then Chris, I'll give you first option. Don't feel you have to answer. We have a lot of expertise in the room, so we'll see who feels comfortable to chime in. Yeah.
Lovely. Thank you, Sharon Creel from the Australian National University. Chris, it was marvellous to hear you speak. I wonder, maybe just your thoughts on the political nature of all of this. We did a series back in 2009, the Lancet series on climate change and health co-benefits, the sorts of evidence that Andy was just speaking about. So that was 2009. We led the food systems work, and I presented that work. So talking about the health co-benefits, and there was 2 country cases. One was the UK and one was Brazil. And of course, part of the calculation was some sort of land management changes and then a massive shift in animal production, basically animal-based food production and consumption. And after I presented that work, the ambassador for Brazil came up to me and he said, "You are absolutely for the birds, because what you've just spoke about is one of the most political issues for us in the country. So you're talking about reducing beef farming in Brazil, which of course is nonsense for that. It was going to be a 30% reduction." So I think I tell the story because the quantification of this is one thing, and really important that we can demonstrate that relationship between the climate actions and the health benefits. But unless we bring into the evidence base an understanding of the processes, the conditions that enable change to happen, then we're just going to carry on having these sorts of massive big repositories of quantitative data that goes nowhere. And I don't think it's just about saying the politicians or the policy folks don't get to hear about it. They absolutely do. But it's that we don't tease apart the factors that are incumbent interests, and there's a whole science about understanding incumbent interests and why they don't change. And then we end up with responses that are putting all of the pressure onto the local farmers. It's not the local farmers, it's the big, massive agribusinesses, for example. So I would love to hear your reflection of the politics and the political economy that sits behind all of this.
Question. Thank you for that one. One more here, I think, and then we'll.
A short one, which is more like a comment to the first question. My name is Kristian Rødland. I'm from the University of Oslo and the Norwegian Institute of Public Health. And when it comes to population control, that's just triggered my mind, or my what I'm going to say is, I feel that within the planetary health community, overconsumption, unjust spread of consumption in the world is somehow undercommunicated, which is the really basis and foundation of planetary health and the problems we face. So we have to start to talk more clearly about the overconsumption crisis, which only a small portion of the global population is responsible for. And that is very uncomfortable and it's difficult. Maybe I don't know what to do about it, but I think we have to start to address it. Thank you.
Or introducing Professor Joyita Gupta, who's just got the mic, because Joyita knows all about this question. So if you can, Joyita, respond to the first question, which is, yeah, don't we need to talk about population control and then relate that to the justice?
So just to come back on the population, I agree completely with the last speaker, but I think there are three elements to the population story. And the first element is that if you want to reduce the number of children a mother has or a family has, then you have to make sure that they have the certainty that their kids are going to survive 0 to 5. And there are other issues with education for women. So you basically do need to meet the minimum needs of people before you can get out of the trap. And so that's one of the very important justice storylines that the SDGs are trying to do. And every time it's put on the agenda, money doesn't come up for that and it doesn't get implemented. And so the population story continues. That's the first part. The second part is when you're meeting such basic needs, it should not be met with fossil fuels, because if you meet it with fossil fuels, you get caught up in the fossil fuel trap, and then you will not be able to achieve even 2, you'll be on the way to 3, 4 degrees Celsius. So that's the second part. And because that's pretty much unaffordable for many of the poorest people in the world, we have to figure out a much better way to do both demand side management of energy in the north, as well as try to finance these kinds of alternative fuels for the global south. And then the third one was the point that he made above, which is basically the top 4% consumes almost as much, if not more, in terms of all kinds of resources vis-a-vis the rest of the world. So essentially the development problem needs to change. And that comes back to the Brazilian story just now about meat eating. I remember when I was co-chair of the Global Environment Outlook, and we had put a sentence in the policymaker summary that everyone should eat less meat because it's better for health. The ambassadors of 2 countries from Latin America stood up and said, take out the sentence about consumption. We said, no, we are not saying about production. And they said, no, take out the sentence about consumption. But I am pretty sure that even if they had not stood up, other countries in the global north would have stood up, because they also have a lot of money in that sector of meat production. So somehow what we're doing here is we're basically trying to ask people to change the way they live, produce, earn. And that's a radical change for not just farmers, it's for all of us. And that's sort of the elephant in the room. Now, how are we going to change our lifestyles? And that's basically the challenge I think we face, all of us. And one small point on cycling and wind energy. Cycling in a hot country is often not advised by doctors because it's so hot, and also because the pollution is so high. So when we have these numbers on cycling on the screen, I begin to wonder, is that possible in places like Delhi? And the other story about wind energy is supposed to use very little water, but if you are and solar energy as well, but if you have solar panels in a dusty developing country, you will need so much water to clean it in order to be effective. So these are things I don't see in the numbers. Sorry.
Covering a lot of the points there, but there were 2 points I think quite closely connected, which were Kristie, you feel like responding to. How do we bring this big picture? How do we bring this big picture down to the ground? You know, how can we enable local farmers to see what they can do in the context of this big picture that makes a difference? And I think that's also at the country level. How can this be interpreted for country transition? What does it really mean? How do we get from this picture that Chris showed at the beginning on the boundaries to enabling those pathways to be visible and acted on at the different scales? This is something the Earth Commission is busy with. So Chris, I don't know if you'd like to give that a go. And Joyita, you may want to comment as well.
It's great to hear your voice, Joyita. The camera only shows you from the back of your head, so I don't get to see you, but hopefully I'll see you pretty soon. Thank everyone for the questions. Those were excellent questions. And I want to pick up, Jane, what you just mentioned, that we need to figure out how to do case studies in ways that can be easily scaled up and scaled out. That in so many areas, there are excellent case studies, as you heard from Andy. But how do you take those to other people, other places? And there has not been consistency within the scientific community on how we can better collect information from case studies so that the repositories we have can be useful to others. So not just what we've already found, but can catalyze going forward. we don't have enough resources, human resources or financial resources, to do case studies in every community. And every case study has to start from the premise, we have to learn what is going to be useful for other places, easily useful for other places, and to commit as scientists to ensuring we can provide that information to the communities, also through work like what you're doing, Jane, working with industry, with businesses, to reset the cultures and reset the practices based on the evidence of what is going to be effective to ensure our common future is more resilient and sustainable. Joyita, would you like to add to that?
Courtney Howard here, who would like to speak. This lady at the end of the first row.
Did someone want to add to? No. Hi, I'm Courtney Howard. I'm an emergency physician from the subarctic, and I have served a majority Indigenous population there for 12 years. We're melting. Some of my patients are experiencing temperatures already 3 degrees Celsius warmer than when they were born. So I've been working on climate change and health, trying to figure out how to make change for about 15 years. So I've done research, I've done policy, I've done advocacy. I even ran for the leadership of the Green Party of Canada at one point. And subsequent to that, realized I didn't know enough about power. So I went back to school last year and did a master's in public policy at the Blavatnik School of Government at Oxford. And I think we need to spend a lot more time with the people in those buildings, because I'm constantly in these rooms and people are like, how does it work? All they do all day, doesn't matter what question, you can be a poli-sci, you can be in negotiations, it's power and how do you maximize it and how do you get stuff done? And so from a practical perspective, so I think, you know, we need way, way more political scientists. We need way, way more lobbyists. You know, right before coming into this room, Canada's budget came out today and they raised taxes on doctors. They did not put a windfall tax on fossil fuel corporations who are making tremendous profits. And they had 2 informants in this newspaper article saying this was because the Canadian Association of Petroleum Producers had lobbied against it. So when I think about where the limiting factor is, I'm a past president now of the Canadian Association of Physicians for the Environment. I have to say I'm very proud of this organization. Catherine McKenna got up on stage at the Canadian Medical Association Summit in the summer and said that we were critical to helping them land the accelerated phase out of coal-fired power in Canada, as well as the national price on carbon. And what I want to say is that takes people. So CAPE now has 17 staff. We have 17 staff, 3 of them have a PhD. This is what it takes to change policy at the national level using a health voice. I'm also the vice chair of the Global Climate and Health Alliance. We have 4 staff. So if we want to counter the billion-dollar PR and lobbying arms of industry in alignment with this super useful emerging evidence base on the commercial determinants of health, which, you know, the series in the Lancet last year very clearly outlined, these are their tactics and this is what we can do in response. We need to build the structures that give us the capability of doing that. If we think that we can win without building the structures that will allow us to counter those influences, we're not as smart as we think we are. And I think, as Chris was saying, that requires funding, and it requires us to be careful and follow the evidence base that some of our communications researchers have provided us with about who are our most powerful messengers. I work with doctors because there's evidence that physicians are some of the most trusted messengers. So if you're going to invest time and energy in anyone and organizing them, I figure organize them, but we know scientists are also trusted messengers too. And so how do we build the machines, fund the machines, so we can take this incredible information that Chris and Andy and others are generating, find our targets for action, coal power phase out, national food guides that enhance planetary health. In Canada, we do have one. And that took a physician running for office, becoming our very first Minister of Health, who was ever a physician, putting up her sharp elbows and creating a policy process that disallowed any closed door meetings with industry. So that's the kind of thing we need to do. We need to honor that work. I believe that work is humanitarian work. And you'd be surprised if you take a step into politics, how sometimes some of your colleagues all of a sudden treat you like maybe you're a little kind of not quite kosher. We need to honor that work as some of the bravest work that I believe is happening. So I would love to see us build, fund, and support the structures that are really required to influence policy. Thanks.
Thank you, Courtney. And I think this gives us the basis of a very good recommendation for this communication session panel on Friday. We can frame a recommendation around that. There's no good as just being right with the science if we can't influence the policy. So we need additional partnerships. This is actually why GCA is teaming up with political lobbyists. They know how to do that. We don't. But in partnership, we have a chance. Thanks a lot for that. And I'm conscious we should invite now our panelists in the room to join me up front so that we can continue this conversation. Chris, please stay. It's probably some horrible hour for you, but if you're willing to stay with us, we'd love to keep you in the panel. But I'd like to invite two other people in the room. Mr. Indra Lim, who is from the Health in Harmony group, but he's the lead in Kalimantan, and it's called ASRI, actually. It's an Indonesian organization, and he's their director. So we're going to learn from you. And Ushar Daniele, those of you who came from the indigenous session already have been introduced to Ushar Daniele, who is a freelance journalist for Al-Jazeera, but she is also a representative of the indigenous community, Orang Asal. Almost got it right. Yeah, so whose daily business is storytelling and communication. But as we saw, she also goes into the forests and really brings the story out. So delighted to have you. And Courtney, if you would like to join us as an extra panelist, would be fantastic. Just introduced yourself very nicely. And Courtney was in our panel in COP28, where we first, asked the question, how do we bring earth science and the planetary health science together for action? So I want to start with you, Indra. Thank you so much for joining. I sought you out. I heard about your organization. We met online, and finally we meet in person. And I'd like you to share your story, really, about how did it all start in Kalimantan? Because Health in Harmony is now in many countries, but it started in the forests in Kalimantan. So why and how did this all begin? Just a few minutes, please.
Okay. Thank you, Jen, for introducing me and my organization. Again, I'm Indra from Alam Sehat Lestari Foundation. So Health in Harmony actually is our sister foundation. The story actually begins since 1993. Dr. Kinnari Webb, our co-founder of our organization, went to Gunung Palung National Park to learn about orangutan. She went there as a biology student. And then Gunung Palung National Park actually is one of the richest and most complete ecosystem on Earth. So it has mangrove, it has lowland, highland, and etc. And then when Dr. Kinnari went there, she saw the local people there, they did a lot of illegal logging there. And then at the time, Dr. Kinnari blamed the local people because doing such a bad thing for our Earth, right? So until she really asked the people, the local people, why they do that, right? So she was again rethinking because the people said they actually didn't want to do that. They just had no choice because they know the future will be bad because they chop down the trees and the forest is their life, right? But they have to survive today because their family themselves are sick. They have to be survived for their own health. And health is not something that you can predict. And it's very costly, especially when you live in the forest, in the jungle, and it's very far away to reach the nearest healthcare center. Because it can reach with very bumpy road for 1 day, and then yeah, and it's very costly. So actually the trees that they chop down, they sell it with really cheap price. The one who get the income more, actually the agent, means that more illegal logging that needs to be done for them to survive, for their medication. And learning from that, Dr. Kinneri understand that actually unhealthy circle happen there. So there's correlation between the health of forest and the health of human. So if the people there chopped up the trees, they cannot be healthy, and then they have to pay more, and then more trees will go, and then at the end, disaster for everyone. And then Dr. Kinneri went to the medical school, went back to the US, hoping that one day she can come back to Indonesia to cure the people there so that no more illegal logging. And then in 2005 or 2006, after the tsunami happened in Aceh that killed more than 100,000 people there, at the time, many donations, many philanthropists sent direct logistic there, send food that the people can directly consume. But the kindness of the people from around the world create another disaster because they don't really listen to the people there, what actually they need. Aceh, they have a culture for the, quite great culture for agriculture. Because of the 2 years, they receive free food from around the world. They don't have preparation for the next agriculture, right? And then another, after 2 years, really the disaster happened, poverty, people starving there. And then in 2007, Dr. Kinneri found ASRI and Health in Harmony to, based on the planetary health understanding and also the radical listening. Radical listening for planetary health, I think all the people here understand. For radical listening is the way the anti-colonialism way to put the indigenous people and local people as the expert. So we go there to radically listening to them, what they need, what the issue that's going on, and what's the solution based on the locality, and then based on the commitment from the people there. And then we provide affordable healthcare for them because probably the people from the local area around Gunung Palung National Park, they don't really have cash. So people can pay with cash, with non-cash. They can pay with seedling, they can pay with handicraft, they can even pay with animal manure, and then they can pay with rice husk, and or even they can work for ASRI to work to support ASRI in a more sustainable way. Yeah, I think that's. Yeah.
I mean, I was really struck by this case because you're really directly connecting healthcare and actually working with the will of the people to protect their forests. So it's really practical. Can you say something about, what's the future? How is this going to extend, and is there a chance to influence policy, maybe at the whole Indonesia level or beyond? Where can this go?
Okay. Thank you for Professor Andi to provide some number. That's actually the achievement that was studied by Stanford University and published in the Lancet in 2020. So actually it's the study of the first decade ASRI was founded. For the current condition, actually we have more than 28,000 something. Right now it's for 46,000 people, mostly the rainforest community can access to our healthcare, and more than 140,000 visit provided. And then actually from that success that we have done in Kalimantan, we are trying to do replication. So since last year, we have MOU with our Ministry of Health to do replication, not only focused in Indonesia, not only focused in Kalimantan. We have done quite well, and then we continue it. We take it as a model for our replication to do it in other parts of Indonesia. We will start this year in Papua, and then we are going to have a scouting trip in Sulawesi Island and also in Sumatra Island, and we focus on a high conservation value forests across Indonesia. And besides that, we actually have planetary health education that actually have been accessed by about 30,000 people offline and online. We have ASRI kids, we have ASRI teens, and then we have teacher training, particularly around the national park. And also we have a public lecture to give lecture in some universities across Indonesia. So young people can understand about planetary health and they can support all the system. And also we have community outreach. So the people there, we can learn from them, and then we can share each other from that outreach. That's the way we do. And also we collaborate with the local government. We collaborate with some NGO around our working area, and also some stakeholders there, the community, of course. Yeah, thank you.
Thank you. So great example of scaling up, scaling out. Just what we were talking about there. And another beautiful thing about Indra is he's actually trained as an architect. But now he's in the business of environment and health. And if you talk to him later, you'll find out this is actually a very useful training for design of such a program. But more of that later. Let's now turn to Ushar. Welcome again. Lovely to, we pass the mic. Lovely to have you in the panel. Keen to learn from you. So a couple of questions. So first, how can storytelling help to drive these interconnected, holistic policy solutions? What's your perspective on that?
Thank you for that question. Before I start, it's a bit different for me being on the panel side, because when I was at COP28, I was the moderator with Courtney and Jane, as well as Kristie on the panel. But I guess this is my chance to answer that question. And being a journalist, I think storytelling is highly important. Storytelling drives the narrative, and storytelling, be it small or big, can change policies. It's journalists and media roles is a crucial part, especially when it comes to planetary health, conversations surrounding planetary health, climate change, because I mean, without the media causing chaos with data that we put out there, with the investigations that we do, we won't see any change. So when it comes to storytelling, participatory ecological storytelling, which creates narratives that feature various characters, various voices, lived stories that you are responsible of telling. Because I mean, if I were to just show you words that I write, it makes no sense. But if I were to connect it to real life experiences like what you mentioned, how the people in the Palu Reserve, in the Palu Mountain, if you turn that real life narrative into a story with data and with information that you can put out there, it drives policy changes. I am going to share a story that I did, which is a wildlife documentary based in Malaysia. It was about illegal wildlife trafficking online. So this was a feature documentary, 47 minutes long. And I, as the producer, I questioned the wildlife department. It's blatantly open, in the open. You could find wildlife like marmosets, dusky leaf monkeys, otters, even owls, which are completely illegal to be traded online. You can find them on Facebook, you can find them on TikTok, you can find them, no TikTok then, but you could find them on websites like moda.com, which is like an e-commerce site, it was so easily available. So I asked the wildlife department, like, how could I find these animals online easily and you could not detect it? And what they told me was, look, we are aware that this is happening, but we also face difficulties in trying to clamp down these activities, because the moment you find one account, they shut it down and they open the next account. And that was not only the sad thing. I think the saddest thing for me to find out was that the penalty for those who were caught for illegal wildlife trafficking was so small. It was merely 100,000 ringgit with like a 2-year imprisonment. And this documentary really pushed the wildlife department to look into the Wildlife Act again. And I think a year after that documentary was published, in Parliament, they pushed to change and increase the penalty for illegal wildlife trafficking. So yeah, it's storytelling, especially when it comes from the media, when it comes from journalists, when it comes from investigative reporting. Yeah, you do get a little bit of hate because of it. You get you ruffle some feathers, but you change policies, you cause conversations happening in Parliament. And I think that's what's important, which is causing a little bit of chaos for the better. And I think with that, especially coming to the planetary health conversation, with the conversation with media surrounding planetary health is very new. It is something new. It is something not yet registered as a concept, because even with climate reporting, it's so scarce to see climate reporters in Malaysia. There are a few of us, but there are only a handful of us. So the conversation surrounding planetary health, I think the Malaysian media, I'm speaking on behalf of the Malaysian media as well as being in this environment in Malaysia, is that there needs to be a deeper understanding of what planetary health is, a deeper conversation with policymakers, especially in Parliament, because now there is a conversation of putting together a draft bill for the Climate Change Act. And that is the first that we are doing. And while it is still in stakeholder engagement level, we're going to see a Climate Change Act bill presented in Parliament next year, which is a step forward. And while that is happening, there is also a need to look at the health of the planet and how it's connected to human health, because just earlier this week, Malaysia is experiencing heat waves. We are experiencing the hottest months in March and February. And earlier this week, we see 2 mortalities from heat waves. 2 people died from heat waves. And while the media is reporting it straightforward as is, okay, 2 died from heat waves, there is no link or understanding of like, there's a bigger picture to this. It's not just a heat wave. Why is it so hot now? And I think over Zoom call with Jay, I was telling her that it's really, really hot here. You need to be prepared when you come here, but then it rained this morning. So it is a blessing in disguise. So I think that's what it is. It is the duty and the onus is on the media representatives, journalists, content creators, even content creators. While you have your media platforms to tell stories, you have the ability to reach out to experts. You have everything at the tip of your fingers. So it is important that we tell stories that shifts narratives, because now policymakers also listen to content creators and influencers, not just journalists alone, because more voices amplify more change.
Thanks. You nicely connected. You nicely connected with the point made earlier about responsibility and accountability. So I think the role of storytelling in bringing accountability and making change is a very powerful one. We can perhaps encourage more of that. Do you want to just give a word about intergenerational leadership in this space of driving connected agendas? And then Courtney, I'll come to you. Yeah.
So intergenerational leadership when it comes to the conversation surrounding planetary health in the Malaysian context. Right now, we have a big group of youth activists that I have personally met them at COP28. I'm young, but by next year, I'm no longer in the youth category. So I'm gonna hand over the baton to the youth. But meeting them and watching them speak and fight for Climate Change Act, they are the most vocal about the Climate Change Act, by the way. We have youth defenders, and having them being included into the conversation, especially surrounding the Climate Change Act, is a massive, massive move. Because all this while you would look at stakeholders, you would look at policymakers, you would look at big businesses, but now youth, you have a seat at the table. And having a seat at the table means having a voice. Having a voice means you have the ability to make changes. So what we need right now is more youth activists, not only in Malaysia, but also in the region itself, in Southeast Asia, like yourself. We have, I keep in touch with youth activists from different parts of Southeast Asia, ASEAN countries specifically. I'm in touch with the Klima group in the Manila Observatory. They are doing amazing work, and they are a youth-led group who is doing conversation. They are involved in bringing the messages of climate change to the public itself, because I have to admit it that science communication it's complex, it's difficult, but it can be done. So having more youth activists being involved in conversations like this, having more policymakers taking into account that their thoughts and their opinions matter is another. And also having policies and training actually surrounding allowing them to be a part of the conversation. Because, well, I was once 21 and 22 and constantly angry, but did not know why I was angry. But I think we all have a reason to be angry now, because if action is not being taken, then this is where the youth have to come in and create some ruckus. So I think we need engagement with youth. We need policies surrounding the protection of the work that they do. And we also would be able to encourage and empower the youth if we have training programs, leadership programs. And I think what Sunway University is doing right now is amazing. You're introducing the planetary health subject into education itself, and that's a start. It's a big start. It's a massive step forward. And I think the youth, like, I'm giving you the bait, and next year, please create some noise, create some ruckus, because I will be here to report all that you do. I'm here to support the chaos that you do into generally. I'm always for chaos. So I'm here to support, I'm here to encourage, and I'm always proud of seeing young activists like yourself. I'm so happy to meet so many students here as well who are interested in sustainability and planetary health. And I think you guys are the step forward from here.
Thanks, Ushar. I think you're a great model example for all those young would-be journalists who want to step into this space. I'm sure they'll follow you. So thanks a lot for all that you do. Now, Courtney, we didn't prepare a question, so I'm searching my mind for like the best question to ask you. But I can also just suggest that you say what you would like to say at this moment. I do have a particularly difficult question, and I'm looking for someone to answer it. So if we get stuck, I'll come to you on that one.
I think I'm good. First of all, I want to say I love it that you like to amplify chaos. That's amazing. And you designed the most beautiful hospital I have ever been to in Azri. I brought my family to Azri in 2018. The hospital that he designed frames the views of this gorgeous mountain with all the biodiversity. The food is the best food I have ever eaten in a hospital. Having these just transition programs, Goats for Widows, as well as the chainsaw buyback. I had just come from COP, and it was the year we were talking about just transition for the first time, and it was all fancy, and I was thinking this had never been done. And then I get to the end of a long bumpy highway and realize that these programs are already happening. So it's an incredible program. I want to talk about tipping points. So when I was a young doctor, I read the Lancet Commission's first report in 2009 in Inuvik, which is one of the world's most northerly teaching hospitals. So sitting on permafrost, I learned that climate change is the biggest health threat of the 21st century. I had never been taught that. I was appalled. I was lucky to end up on the board of the Canadian Association of Physicians for the Environment before I knew anything, like through sheer enthusiasm. And I showed up at my first meeting, and I essentially said, we need to solve climate change. And the executive director, who came from environmental campaigning, asked me, well, what's your target? And I said, I don't know. What do you mean? We need to solve climate change. And he just kept asking me, what's your target? And I didn't have a clue what he was talking about. He eventually decided that our target, the best, most effective and ambitious concrete change that we could make it as an organization was to support, to lend the health voice to the accelerated phase out of coal-fired power in the Canadian province of Ontario. So we did. So we had doctors in scrubs and stethoscope standing next to policymakers saying, yes, if we phase out coal-fired power, we're going to keep kids out of the emergency department with asthma. That allows us to save money as a healthcare profession. The kids get to go to school. Parents don't miss work. And that worked. And in fact, that completed coal power phase out remains the single largest decrease in greenhouse gas emissions ever achieved from a single policy in North America. And so then we did the same thing in Alberta. We did the same thing nationally. And what I learned is that most of us unconsciously, and there's academic work to support this, have an information deficit model of change making. We unconsciously believe that if we tell people stuff, they'll change their behavior. And that is a completely evidence-free change making mental model. And so the way I now teach advocacy, because I've been at this for a while, is target-based advocacy. So pick the most ambitious target that has the highest degree of co-benefits that you think that you and your team can achieve with the power at your disposal. Take the risk of making that happen. So you might lose. And if you lose, it feels bad. However, almost every single time you've gained resources, you've gained some social capital, you've gained political capital. Someone noticed what you were doing, thought it had potential, delivers some financial capital. So you give it another go, you try again. And eventually what I've learned is you win stuff. And when you win, and this is a word I learned in my political science classes last year, is you get this effect called bandwagoning. People like to join a winning team. And so that really impacts resources. And so that's the way we work at the Canadian Association of Physicians for the Environment. I believe that's why we now have enough resources to support 17 staff. And so a few years ago, I was asked by a very large group of emergency physicians, if we all work together, what is the maximum climate impact we could have? So we took a tipping points approach. We said, okay, we have enough people here to create social tipping points. What does that look like? So we took a look through the tipping points literature, looked for case studies where a health group had accomplished something that had previously been identified as a tipping point. So some of them are phasing out coal-fired power. Some of them are divesting from fossil fuels. Different medical associations have divested from fossil fuels. We didn't include them in the list unless someone had done it, unless we had an actual case study. And then we created a list that was in support of that with action items at the micro level, the meso level, and the macro level. We published it. It's called, I showed a bunch of the slides yesterday. It's called Learning to Treat the Climate Emergency Together, Social Tipping Interventions by the Health Community. And now we're just going about getting those into everybody's strategic plan. So a lot of that is in the Global Climate and Health Alliance, what work we've been doing. The Declaration on Planetary Health that I'll be talking about tomorrow during the education session has now been signed by all of the Canadian medical schools except one. It contains almost all of those elements. So we're looking to organize to make those things happen. And just thinking the Global Climate and Health Alliance, one of the ones is supporting the call for a fossil fuel treaty. So we started working with the treaty folks, and we got enough because we have a giant network now of over 180 organizations. We got them to support a call for the fossil fuel non-proliferation treaty that gained so much traction. I think we had 40 organizations representing 46 million healthcare professionals that the WHO felt safe enough to sign on. And once they felt safe enough to sign on, we started seeing the countries signing on. And the treaty folks told us that it was the health voice that lent enough social support for the politicians to feel safe. And so what I'm really curious about when I'm looking at this broader map of tipping points, what does it look like if we as a community map across all of the different planetary boundaries, thinking about the tipping points and also thinking about the places where Andy and others and Chris have identified places of maximum co-benefit and intersecting that with the treaties? What are our major targets that we can start to work on at the international treaty level, that we can trickle down to the national level, that we can trickle down to a community appropriate level? Because when I ask people, when people say, you know, what should I do? They want to know what the highest impact targets are. So what are those and how can we use those in a very target-based change-making way, amplified by evidence-aligned, effective communications to tip as many things as we can through global coordinated action. That's what I want to know.
Fabulous. Thank you very much, Courtney, for that intervention. So what we heard there, target-based advocacy, also courage, very, very important. But I really like your concept because it fits very well with that of the Global Commons Alliance of focusing on the tipping points and the geographies that link to the places and the issues which matter the most for the planet, including the people and their well-being. So, and having this trickle down, trickle up effect, connecting the layers. I think that's very profound. We just have a few minutes left. So I want to again go back to the audience. And at this point, I would just request that you point to something which is near a recommendation that we can take forward from this session. So questions are allowed. Chris is still available. And then I will quickly go to the panel for your last word, short sentence.
I can't pretend this is a recommendation, but it's really a question out of ignorance and curiosity. I wonder if anybody has an opinion on it. It resonates with me that going directly to policyholders, I think policymakers, is pushing a boulder up the hill, inefficient. It's difficult to make that change relative to, say, influencing the masses. If that happens, then the policymakers or corporations would chase the trends, it seems to me. I know neurology has said that storytelling, as you said, is the best way to influence and present an idea. So if storytelling is the right tool to use to influence the masses, which story, which medium, what our scientists say within arts and humanities, is it, it's probably not journalists. I would imagine, although journalists certainly are amazing storytellers with facts, but using emotion in our stories, is it our songwriters or our movie makers? And what strategies might exist in engaging something like this, but maybe with, if let's say it's our songwriters, Taylor Swift and Beyonce or something like that, with our greatest planetary health scientists around the globe, just a very small meeting to garner that engagement. What strategies have we explored that?
Great question. So move the masses to move the policymakers, get to their hearts through, well, we could have a very interesting discussion about which songwriters, but we get the idea. Yes, Andre, please.
Thank you very much. We've known about the evidence that the world is in danger since the Brundtland report. Some of you were not born, but 1989, an awful lot of things was happening already there. And we pushed out this information time after time after time. And it's been written about by all sorts of storytellers. So we have had stories left, right, and center, examples of mismanagement, example of problems that does mean. So somebody today who's making a decision on allocating asset at every level possible is in full possession of the facts. And the fact that some people are still doing it is a very simple reasoning. It's because it's in their interest to do so and not in the public interest. So I think one of the tools we should be using much more is the legal tool. We've just heard 5 million people die with poor quality air every year. I mean, it's no longer civil, it's murder. And if it's murder, you need to go to the courts. And I think it would be quite an exciting moment if we could use a little bit more. I hear the idea of provoking chaos and multiplying chaos and making sure that chaos sort of moves us all. Well, civil disobedience is a way of provoking some judicial pronouncement, which I'm sure can be helpful in that case. So I'd be very, my recommendation would be let's change gear and let's be a little bit more violent about this. We know enough now. It's time to get the rubber to hit the road.
I think that we deserve a round of applause for that one. Yeah, so ecocide is as a tool and a concept is quite fast rising. This concept that Andre referred to. Also, rights for nature is becoming a more powerful legal tool, and yeah, needs to be in our toolbox. Okay, other questions, contributions? Yes, Dr. Jamila.
Jane, I just wanted to build on what Andre said. I think we are seeing legislation now becoming a positive tipping point. We don't talk about it enough, and I think because most of the time health experts are not familiar with law. I just give you one example, and let's keep our fingers crossed it does lead to success. I was asked to provide a commentary for climate and health for the Pacific Islands. And I think we wrote a fairly compelling commentary, so much so that the Pacific Island states decided to include it in the docket to the ICJ. So, we'll know by June, where this goes along. But, as a health professional myself, I'm not familiar with the law. Well, but what Courtney said is, how do you move power? I think this is why I'm so attracted to Planetary Health, because it is transdisciplinary. It's about disruption. It is about changing the way we do things. And, yes, doctors have a lot of trust, when we speak, people take notice, but speaking is not enough. I think, we need to hit where it hurts, to put it crudely. So whether it's through legislation, whether it's through, political threat, I think at the end of the day, young people, why politicians are nervous is because young people actually can tip the balance. In our country, in Malaysia, just before the last election, we finally, because of the work of young people, they got a law through for people above 18 to be able to vote. And that swung the entire, results. So I think, the power of young people, the power of the law.
Great point. Yes, thank you, Jamila. This gentleman over here, and then actually, Chris, I'll come see if you have a comment on what's been discussed in the room, and perhaps a recommendation that we can take forward. Yes, sir, please.
Thank you very much. I'm Paul Bungie with Conservation X Labs. I love this conversation around change making, power structures, and I want to pick up on something, Dr. Jamila, you just said, and I'm going to phrase a recommendation in the form of a question, which is the role of other disruptive forces, and what is the role of things specifically disruptive business models, disruptive technologies. Think how mobile money completely upended banking in places like sub-Saharan Africa, for example. What are the ways that we can actually engage those sorts of things that change the facts on the ground and the ultimate power structures, either as a result of undermining entrenched interests, particularly industrial and the like, and thus shifting the sort of decision-making that may happen at the policy level. And I actually, as a specific question, I love what Sharon asked. Maybe I'll put it this way. What happens when the Good Food Institute realizes its goal of price and taste parity of alternative proteins relative to animal proteins? How does that transform the dynamics of decision-making, both in country and other places around meat production?
Can you have? Okay. Oh, this lady in the middle here. Yeah. Wait for the mic, please. Thanks.
Thank you. This is Jaya from Internews, and we work with journalists, but I was wondering whether we could get access to case studies and evidence that was more holistic. Many of the case studies demonstrate a linear success model, like you cycle and then you sort of, it reduces the pollution, but it doesn't make out a political economy case really that the health sector could use to talk to policymakers who hold the purse strings. Yeah, that was my short comment.
Lovely point, because we're talking about the need for integrated holistic solutions, but yeah, we're not getting the evidence. One of the things the Earth Commission is actually working on is to help visualize in real landscapes, real places, if you would apply the Earth system boundary approach, how would that landscape change? And it's actually very beautiful because you start with the stark reality of how it is now, and within like 5 seconds, the visualization of how that actual landscape would change based on the science comes before your eyes. That, I think, has the potential to engage people's hearts as well as their minds, and then look back into the logic. So that's the holistic visualization. So not just numbers and charts, but real places visualized. Yeah, I mean, these things, I think once the heart is engaged, the numbers can be looked at. The numbers, as has been said by itself, they're already stark, but it isn't changing anybody, unfortunately. Okay, thank you. Don't see any other hand. Oh, Yes, my new friend from the Netherlands, Annemarie.
I'm Annemarie from the Netherlands. Courtney, it might be thought very simply, but the food system, I see a lot of, like the biggest link maybe between health of humans and the health of the planet by our dietary choices. Do you think that would be something that physicians can push more and more to politicians, that if we change our diet, I think on all the planetary boundaries, we will have huge advances. So not only climate, but nitrogen, phosphorus, fresh water use. And I think that physicians have a very good position to influence this.
Can you be really short because we just have a few minutes left?
Sure, we did that. I spent a whole summer writing a submission for the National Food Guide policy to support this doctor who managed to get herself being the Minister of Health, and it worked. Like we actually launched Canada's new food guide within 2 weeks of the Eat Lancet Commission, and they look exactly the same because they were an evidence-based process. And I just wanted, sort of in response to what you were saying, and this will be my last word, what my experience is if you want to actually win something, you need to address all of it. You need somebody showing up with the policymaker with a beautiful evidence-based brief, nicely presented. You need a communications campaign that speaks to everybody. You need a distributed chapter structure so that, like CAPE has doctors organized in all provinces in Canada, so they go see policymakers at their level. You need to engage the media. You need to have a communications person who has done that work to get those contacts. So what I'm saying is it needs to be organized, and it requires best practices across all of those disciplines, across political science, across communications, across policy. Because if you don't show up and talk to the policymaker and have them learn who you are and trust you, I can guarantee it that someone from the fossil fuel companies in Canada, the lobbying ratio is usually about 5 to 1. So at this moment, they're seeing 5 visits from a fossil fuel representative for every 1 from an NGO. And until we reverse that ratio, I don't think we're going to win. So how are we going to build the structures to make us win?
Thank you very much. So we better get organized. I'm very sorry, sir, but we're a bit out of time. So I'm going to go to Chris, Ushar and Indra and just ask for your 30-second last word and before we close. Thanks. Over to you, Chris.
First of all, congratulations on really an excellent session. It's really been remarkable. I would like to strongly underscore, Jane, something that you said. Humans as a species are really quite poor at visualizing the future. We think the future is the same as today. And what we see today are all the problems. And finding ways for us collectively to be able to portray what the future could look like in ways that are compelling, that really engage the youth, engage the politicians, engage our industries. We have to have everyone on board and know that we're working together for something that will be more positive, will be the incentive that will help get many more people on board. And I look forward to working with everybody on that. Thank you.
Thank you, Chris.
Mine's going to be very short and sweet, and I'm still going to talk about storytelling. And I wrote this sentence, I'm just going to read it out. It's really short. So storytelling serves as a powerful tool to inspire action, foster empathy, and drive meaningful change by creating a shared understanding of environmental challenges and interconnectedness of health, climate, sustainability issues in Malaysia and across the world. That's all.
Thank you. And Indra.
Thank you. Like what Ushar said, Planetary Health is kind of new, not so famous yet, but actually the local people understand very well. So I invite all of you to come to ASRI to see what Planetary Health action that we really done since 2007 that we actually learned from long time ago before that. So feel free to come to ASRI. And then Planetary Health actually is not only the responsibility of health practitioner, environmentalist, researcher, actually is the responsibility of all of us. We are all well connected. So actually what we do in Kalimantan has significant impact in the global north. So it's far away, but we are connected. And yeah, so let's contribute, let's collaborate each other, and let's together we create healthy people, healthy planet, healthy for us and for our next generations. Thank you.
So with that, I'd really like to thank our fantastic panel. I mean, we've had really the top scientists, including some contributions from the room here, who know the most about the big picture, but we've also had people here really at the front line of making the change on the ground. And I think we've done quite a good job at seeing how these might be connected up for bigger change. You'll have to trust that my colleague Aditi and I will draw out of this a few recommendations that can be taken to the communications panel in the plenary on Friday. So we'll do our best to be loyal to the contributions. But lastly, I'd like to really thank all of you in the room, because you've been a fantastic participative audience, asking some challenging questions and putting in your experience and your ideas. This is super valuable. If you have more thoughts, more questions, don't hesitate to contact us. So my email is very easy, jane@globalcommons.org. Happy to hear from you with your thoughts, questions, suggestions. So thanks, and give yourselves a round of applause. And thanks to those who've supported the volunteers and others who've supported the techniques here. You've done fantastically. Thank you very much.